Wayne Walker.
Wayne Walker.
Wayne Walker.
Wayne Walker.
This is complete package in my eyes. Like it's got great shape, it's got great condition.
He is the next big thing in bodybuilding. Mark my words.
What up, peeps? I'm here at a surgeon's office. I was diagnosed with having a complete ACL tear from being in a car accident. So I'm here to see the surgeon, Dr. Errol Yildiz, here in Fort Lauderdale. So I'm going to see him, hear what the procedure is going to be like, what the cost is going to be like, hear what the procedure is going to be like, what the cost is going to be like, what's the recovery time, and stuff like that. We're going to also get to find out how bad the ACL tear is, if it can be fixed, and stuff like that. So I'll be sharing this whole experience, this whole journey with you guys, being a bodybuilder and, you know, being any athlete at all and having to suffer an injury and needing surgery for that particular injury. It can be very daunting on the mind. It can be harsh on the mentals in terms of not being able to train, not being able to compete, and just being inactive and not doing the things you love, and, you know, pretty much having to find a substitute for the time you recover. So I'm gonna share this journey and share this experience, and anybody who also suffering from an injury or had suffered from an injury or has an injury that needs to be operated on, we can get through it together, and I'm going to share my experience and hopefully can help you get through your situation. All right, I'm in the doctor's office now. I'm waiting to see him. So I'm in the doctor's office, waiting to see him, waiting to hear my verdict. Apparently these are some of the people he has worked with. I'm not sure if I can see properly. He has some autographed pictures and so forth. Yep, so I await my verdict, sitting there patiently. Same knee injury. So you're saying just from moving it with your hands, the good old-fashioned way?
Exactly that. In the knee, there's that ligament that holds the two bones together called the ACL, the anterior cruciate ligament. And in your case, it's completely torn. So your knee, we can shift and we can move in a way that's completely abnormal.
Okay.
And the problem will be that will prevent you from doing certain things short term, but long term, the longer that this moves and goes like that, you will start damaging the cartilage more, called the meniscus tissue in your knee.
Okay. You
already have tears in your meniscus on the MRI, but it will get worse if we neglect this.
Okay. So with the operation also fix the meniscus that's already torn?
Correct. So we will address everything that's present within the knee.
Okay. Okay. All right. What is the procedure? What is the corrective methods that you do?
A lot of our body heals on its own, but unfortunately this ligament does not. So we have to put a new piece of tissue in its place. We'll talk about that in a second.
Okay.
But it's done arthroscopically, which means 3 small incisions around the knee. Takes only about half an hour to do.
Yeah.
You go home the same day.
Yeah.
But you have a brace and you have crutches for 3 weeks or so.
Okay.
You begin physical therapy right away. By 6 weeks from surgery, walking without a limp. By 3 months from surgery, a light jog or light jump. And by 6 months from surgery, you begin cutting and pivoting or moving athletically.
Okay.
So for somebody in your line of work and enjoyment in your career and, you know, function, it will sort of slow you down in certain ways for a bit.
Yeah.
But you can do upper body stuff right away.
Yeah.
Lower body will alter some things for a few weeks.
Yeah. I was doing some research and I was seeing where they say they could take, there's a procedure where they take probably a muscle from the hamstring and pull it through and all of that. Correct. That's not what we're doing though.
For somebody like you, where strength, function, and this word also image is important as well.
Exactly.
We don't want to mess with any of your muscle tissue.
Precisely, I agree.
So we apply more likely use cadaver tissue for you, meaning from somebody else. It's
Okay.
been processed, been sterilized.
Okay.
Risk of disease is about 1 in 2 million.
Yeah.
But it's used a lot.
So my body won't be rejecting it or anything like that.
Correct. It's not like a liver or a kidney where we have to take rejection medicine. That will not happen.
Okay.
We tend to not use it in the very young, like a 10-year-old, 15-year-old, but you're an adult, obviously, so it's safe and reasonable to do. The odds of success are very good, like probably close to 95%.
Yes, sir.
That you end up with a good knee.
Yes, sir.
I'll put it in the right way. You follow the rules rehab-wise,
Yeah.
good stuff will happen with us.
And doing this procedure, I won't be experiencing what I'm experiencing currently. Once I let it heal properly, no pains.
Correct.
I'll be fine kneeling, stooping,
Correct.
squatting.
So that number I mentioned, 95% chance of you returning to your normal function.
Yeah.
Getting up and down, being very satisfied where you say, hey, doc's great, he fixed my knee, it's stable, and I can function the way I want.
Yes, sir. Yes, sir. And you're saying roughly 6 months back to light exercises and so forth.
Feeling more athletic with it, yes.
Yeah. All right. Okay, guys, you heard it yourself. I'm gonna have a lengthy recovery process. Physiotherapy, walking with crutches. Won't return to normalcy until about 6 months in, before I can return to my normal self and doing exercises. Yep. So that's half of the year. No competition, no training, no Olympia qualification, none of that. For a whole year, I'll be out. What am I going to do? How am I going to survive this? We shall see how we're going to approach all of this. But most importantly is to get the surgery done, get it done properly, heal/recover properly. Yep, I think I've come to terms with the fact that I'm gonna be out. No training, no competing, none of that. I think I've come to terms with that. I think I've mentally accepted that, and I'm there mentally. I just want to get the surgery done and get it done as soon as possible. If I can do it tomorrow, I'm willing to do it tomorrow, just so I can start the recovery process. The plan is, as I mentioned, is to document as much of this as possible, so I can share with persons who are also athletes themselves and who may also suffer from a similar injury, or just suffer from an injury that needs operating on, period, you know. And we can share ideas together as to how to get through this. So I'm gonna try and get through this without getting depressed and being sad and being sorry for myself. Try not to get fat, you know what I mean? Stuff like that.